Cool. Okay, so the recording's on now for anyone who can't make it during this time. And I'm going to just share my screen now. Okay, so hopefully you're all seeing my screen here. So I've got a little document together with some of the housekeeping and to talk us through a bit of an activity that we'll just go through as a group today as well. So if I can make that a bit bigger. Okay, so some important housekeeping points. I'll sort of jot these down in an email that I'll send out very shortly as well, but just sort of making it really clear to the video conference, the people coming to video conferences, as well as giving some space for people to ask questions about that as well. So as you know, and what we've been talking about is the mid-semester exam being available in week 7. I think I mentioned it last week. What we're planning to do is have that open as of Wednesday next week. So that's the 15th of April, and have it available through until the 19th. So similar to the quizzes you've been taking so far on the content, that'll be open for a period of time, and you can take it anywhere, anytime you want during that period. At the moment, we're looking at a time limit of about 50 minutes. So that might be pushed up a little bit, but I think it won't be any shorter than 50 minutes at this stage. We'll confirm that maybe with the email I send out at the end of the week. But I don't think anyone's really going to be pressed for time, assuming that you've done the preparation for the mid-semester exam. So that'll go live on Wednesday. Bear in mind that's after our video conference next week. So obviously today we're talking about preparing for the mid-semester exam. Next week we'll do one more sort of recap of some concepts, as well as what I want to do next week is throw up some examples of some conclusion paragraphs and get people to maybe critique those, or maybe people can send some in and we can all give some feedback on those in groups next week to really make sure we're prepared. And then as of Wednesday, it'll go. Any questions about the mid-semester exam logistics at all? No? Okay, cool. All right, the second housekeeping point that you might see I've got there is the descriptive stats content. So typically we open this up in week 7 and we give week 6 as a break from the modules. So what you might have noticed in the unit outline, some of the descriptions around the place, is there's actually 10 content modules in 217. So it's almost every week, but then there's 2 weeks that you're not going to have content modules for that week. So one of those weeks is reserved for week 12, where we've got quite a bit due. We've got the group project as well as the competency exam. Typically the other week where we don't have content is in week 6, which helps you prepare for the mid-semester exam in week 7. Now, because we've got the mid-semester exam the back half of week 7, and it's an online exam now that you'll be doing, it may then, I think the difficulty is that probably causes a little bit of trickiness in week 7 when you're going to do the descriptive stats module as well as the mid-semester exam during that week. So what we've decided to do is open up the descriptive stats module and quiz as of yesterday, but you can complete it anytime you want in the next 2 weeks. So it's due not this week like every other module opens and then shuts in the same week, but this one we're giving you a longer period of time. So over week 6 and 7, basically we're leaving it up to you to manage descriptive stats content quiz, as well as preparation for mid-semester exam and completing the mid-semester exam online as well. The other thing that you'll be working on, you can see in the third housekeeping point there, which is the group project. And so I've just got a little bit of info there about the draft aspect of that and how we're tracking, but I might come back to that later when we tackle the group research project at the end. Is there any questions about any of those housekeeping points there before we dive into a bit of a group activity? No? Okay. All right. So then what we might get into is that activity I was talking about. So we've got, basically what I've got down here is just to make it really clear to you guys what questions you're going to get in the mid-semester exam. So the mid-semester exam, I guess to recap, is going to be online exam now. So you're going to click on the available link for mid-semester exam. It's going to open up. There's going to be a link within the first question to an abstract. So it'll be a PDF document of a 3 or 4 page abstract. So you'll read through that carefully, and then you've got a series of multiple choice questions, a few short answer questions, and a long answer question, all within that quiz on Leo. So there'll be a number of different articles that you'll get randomly assigned to for that one, so you won't probably have the same as people, other people you might talk to about the exam. All the questions are specific to your abstract, so we'll be asking about certain concepts that relate to your abstract. Some answers will be the same no matter what abstract you get, but a lot of the answers will be different depending on the abstract, like what are the independent variables, dependent variables, etc. So the questions, basically the focus of the questions, or the type of questions you're going to get, are really, I've outlined in some of these dot points here. This kind of aligns, it should be pretty plain already to see from the activities that we've done in tutorials, both face-to-face and in class, as well as the content. So hopefully none of this is a surprise, but I just wanted to make it super clear the sort of things that you're going to be asked. So I'll just go through really quickly here. So you will have a couple of questions that are based on the introduction to research concepts from the week 1 module. So there will be a question around sort of the peer review process, or what that entails or goes through. There might be a question about whether it's a research or review article. So knowing what the difference is between those two is going to be important. There's going to be a few questions around ethics and law. So the ethics and law processes, so going through an ethics committee, and what type of ethics committee that research might have to gone through. Different types of ethical misconduct, so whether that be plagiarism or any other sort of misconduct there, you're probably going to get a question around, and there's going to be a question or potentially a question around ethical considerations of research. So maybe someone could let me know, actually, no, we'll do that in the activity next. Then you can see here there's a number of, so a big chunk of it is the research methods, because remember we've got 2 weeks of content in there for the concepts. So there's going to be questions around sample, dependent variable, independent variables, extraneous variables, internal, external validities, limitations, delimitations, basic applied classifications, qualitative, quantitative classifications, experimental, non-experimental classifications, instrument reliability, objectivity and validity, common research errors, and then there'll be some questions, or a question or two around academic writing. So what belongs in different sections of an abstract or an article, as well as actually creating your own conclusion paragraph. So that'll be the last question, is you need to actually complete the conclusion paragraph that's missing from that abstract. So hopefully that's all pretty clear, but what I wanted to do to kind of highlight that is to give you a little research topic. So last week I gave you a few examples in the video conference of things, the free throw shooting and maybe the ice vest type examples. So what I want to do today to highlight the different questions that you're going to get is just a broad research topic, maybe with a few details filled in, and then we can come up with ideas of what sort of design that might entail, and then some questions or the sort of questions you might get answered in your mid-semester, exam. So maybe if we can, well, the example that I've got that I'm thinking of is the fitness in post-knee surgery. So obviously when we have a major knee replacement or other significant knee surgery, typically we're out of action for a significant period. Often it involves things like ligament and tendon damage or cartilage damage in there. And so it can affect not just a single type of fitness, but actually it can affect fitness across the board. So you're probably not doing a lot of cardiovascular work during the time of injury through surgery and early recovery stages. So fitness, not just for athletes, but for anyone who goes through knee surgery, is a pretty important aspect of the recovery. So if we're interested in that research topic, there's numerous, almost infinite different research questions we could ask within that space. But I've got a couple, I've kind of filled in a bit of details here. So let's say we're interested in that, and we've got a sample of 120 patients, somewhere between 6 to 12 months post-knee surgery. We've got kind of a mix of males and females, and we've decided to have an age group of 25 to 65 years old. So we're sort of controlling the age group to some degree there. I've got a few examples of dependent variables there. But before we get into those a bit more, and then the other types of questions, irrespective of how we're going to test these things, what are some of the key ethical considerations that we have before we actually start the research and as we continue through it?
Any risk to re-injury of the knee?
Yeah, definitely. So do you think that this group is at a higher risk than like a general population?
Yes, I'd say so, depending on what sort of testing I'm going to do with them.
Yep. Yeah, for sure. So they're definitely at a higher risk of recurrence of knee injury. Certainly that we'd have to make sure we modify what we're doing in there. So if we give them an exercise intervention for fitness or some sort of training, whether it be for their knee or for other aspects of fitness, then we're just going to have to be really cognizant of the potential of re-injury and the needs of that, of their sort of range of motion and their strength and all the other aspects that are really going to be important in that exercise program for them. So definitely specific to their injury. So let's put in here risk population. Yep, so that's one of the considerations. Are they an at-risk population? What else? The easy one that probably should be the first one that comes to mind in terms of ethical consideration is informed consent. So are they an at-risk population? So even if they're not, even if you're dealing with a different population, one of the things you want to ask yourself is it an at-risk population? You want to think about informed consent. So how are we actually informing them? How are we getting consent? How are we logging that? Other aspects or considerations?
Confidentiality.
Sorry, Johnny, can you say that again, mate?
Basically what Lachlan just said, are we looking at the privacy and confidentiality of all the participants as well?
Yeah, definitely. So confidentiality. So we're going to have to figure out how we're actually looking at that data. Are we de-identifying the data? Where are we storing that data? How secure is it? And there's obviously lots of rules and regulations around how we do that in research. Any others?
We supply them with the results from our findings.
So again?
We supply them with the results of our findings and what we are testing.
Okay, great one. Yeah, so that's one of the other really key ones there is disclosure of findings. So how are we actually, not just reporting that in terms of published literature, but how are we actually giving that back to participants? How are we making them those results available to them? So that's a good one. Okay, so what I'll do, there's a couple of others in there that you could put down that are going to be important for a question like that, but I might leave that up to you guys to have a look back through the content and have that prepared for the mid-semester exam. So we talked up here about processes and things like that. So I'll leave that as well, and we'll get into some of the research method stuff. So sample here. So a question in the mid-semester exam might be as simple as what's the sample size? It might be something around the sampling procedure. Now I've thrown an idea of what we might have in terms of sample here. We might come back to that in some of the other variables later on. Dependent variables, we could think of all sorts of things to test fitness, but I've given some examples here of like VO2 max. So that would be like testing out your cardiovascular fitness. And it might be something that we can do fairly close to post-surgery as well by actually testing VO2 max using an arm task rather than a leg task. But then obviously an important one in terms of fitness for post-surgery for knee is going to be leg strength. But there could be an indefinite amount of dependent variables. And this is one of the ones that people struggle a little bit to define is what is a dependent variable. So can anyone give that to me in their own words? So feel free to chime in, or yeah, we can start using the chat function a little bit more, I think would be good as well. Ideas?
It's the variable that's measured or that we're changing and manipulating.
Yeah, good one, Caitlin. So it is. It's really hard to put in words actually, but it's something that we're measuring. So to be a dependent variable, we definitely have to measure it. There's a lot of variables. We'll talk about extraneous variables in a second. There's a lot of variables that we might consider and control or not control, but to be a dependent variable, we have to measure it. And it's something that we sometimes talk about as the outcome variable. It's the variable that we might be comparing across two groups or looking for a relationship between different dependent variables. But it's essentially what we're looking for an effect on. And so if we take VO2 max as our dependent variable, we could do all sorts of things where we create two groups and compare them on VO2 max. We could look for, say we've got VO2 max and leg strength, we could look for a relationship there to see if there's a correlation between those two. But if we're using those as the outcome that in some way, then that is a dependent variable. Yeah, nice. Independent variable. What could we have as an independent variable in this research? I think?
Gender.
Yeah, nice one. So if we had gender as an independent variable and we compared, say, VO2 max of patients 6 months post-knee surgery between males and females, then what type of independent variable would gender be, active or attribute?
Attribute.
Okay, so gender's attribute. Can anyone think of an active independent variable that we might have in this type of research? Something that we could give to participants and then compare them on it?
Could a supplement be like an active variable, like if it's a painkiller sort of drug?
Yeah. Absolutely, yeah. So definitely we could have, give them a supplement. We could have a exercise intervention. We could compare them on age, for example. That would be another attribute. Okay, so we've got a whole bunch of potential different independent variables. Now, obviously, if we had, the more independent variables we have, the more complex our data set gets and our analysis gets. So at a simple level, and for your guys' group research project, we're probably just going to want one independent variable. But what you will notice is in large articles or large studies, they often have multiple independent variables. So gender, age are kind of independent variables that we could compare fitness between two groups across, but they would be attribute, supplement, exercise intervention, things that we actually give participants would be an active independent variable. Okay, so other than these things, is there anything, do you think, that could affect the VO2 max of participants during that recovery phase of knee surgery?
Whether they have any other conditions like asthma, maybe?
Yeah. Yes, any other conditions or morbidities? Anything else?
If we're talking about extraneous variables, we've got to consider maybe whether they're smokers or not.
Yeah, definitely.
Their physical activity before surgery.
Yeah, definitely. Nice one, Lucky. So you said smoker. I put down medication as well. So any other drugs they might be on, physical activity prior to surgery, diet could be a factor. There could be certainly with, we know with joint aspects, we've got gender in there, but there could be also this other related hormone factors that we know affect tendons and ligaments quite significantly. So all sorts of extraneous variables could be playing a role there. All sorts of other factors that could be influencing our VO2 max that is not our independent variable. And so with these...
Would genetics fall under that? Sorry, Matt?
Yeah, absolutely. Yeah, so some people are naturally going to be predisposed to a greater VO2 max or leg strength, or they're going to respond differently, for an example, to a exercise intervention. So something that we don't talk about a lot in exercise science, well, we do a little bit later on sometimes in the course and things like that, is non-responders to exercise. So we genuinely have aspects of the population out there who do not respond in a positive way to exercise. They don't have the normal building process that goes on as a response. So there's some breakdown in the process there. So we know that those things interact differently. So genetics, diet, physical activity, medication, all sorts of different extraneous variables there. Now, some of these we find very difficult to control for. Others we could fairly easily control for. So we've got a kind of decision on what we control for, which then does affect things like internal, external validity, and basic applied classification, or how basic or applied our research is as well. So the more that we control these extraneous variables, what does that do to our internal and external validity? What do you think? Feel free to shout it out or put it down in the chat. So more control of extraneous variables does what to internal validity? What do you think? Increase or decrease?
It
Would decrease.
would increase.
Increase, you say?
Increase. Okay.
Increase? Yeah, that's it. So more control over extraneous variables increases our internal validity, because then we can be more sure that what we're actually manipulating or looking at or comparing, so say we're comparing an exercise intervention, those who did an exercise intervention versus those who didn't, then we can be assured that whether we find a difference or not, that it's because of that independent variable, because we've controlled for all the other extraneous variables. So controlling extraneous variables increases internal validity, but the trade-off is that it decreases external validity. So while we might be more sure of our results for that particular controlled experiment, we're less sure that those results actually apply to the real world, because the real world doesn't control for extraneous variables. So there's a trade-off there in the control of extraneous variables for internal and external validity. There are some things, though, that increase both internal and external validity. What would that? Can you give me sort of one of those, or the major one of those? Any ideas? So Gray's sample. So if we have more participants in our study, not only are we more sure of the results that we have within our study, but we're actually more sure that those results will be applicable to the outside world, because we have a greater variation amongst the sample that we have. So there are things like sample that increase both internal and external validity, but there are other aspects like controlling for extraneous variables that are actually a trade-off between internal and external validity. So that's something that's really important to know for research design, but it's certainly something that's going to come up in the mid-semester exam as well. It sort of starts to feed into the question of limitations and delimitations. So the difference between limitations and delimitations is the intention. So a delimitation is a deliberate restriction of a study. So limitations and delimitations are both restrictions, but delimitation is a chosen restriction. Can anyone think of a chosen restriction that we've talked about already?
Our samples, we've just gone to people between 25 and 65, no one younger.
Perfect. Yeah. So this seems like a sensible thing to do, and this is the sort of things that that even in the first week we did the face-to-face classes, when people were designing it without knowing about these concepts, people were wanting to control for the populations in their studies that they were planning for. And that was to control for extraneous variables. So we know, for example, that after, as you get beyond the age of around 65, and this is obviously very different for individuals, we start to have neurological decline that can affect our response to exercise, but also the regeneration of tissues and all sorts of other aspects as well. So if we have that in play with populations who are younger, then we're going to see a different mix of the results. So again, that's one of our extraneous variables in terms of age that we're going to see a big effect on. Even if we're comparing age as an independent variable, we still might restrict the age groups within those populations, and therefore those are delimitations of our research. So delimitations are deliberate, whereas limitations are not deliberate. Now, sometimes that's not deliberate because we are logistically constrained. So having a fairly small sample size is usually not a deliberate thing. It's something that we didn't have much of a choice over. But then there's other aspects that we maybe just didn't, that the researchers didn't consider. So maybe there's a limitation that comes up in the research where it just really was a flaw that wasn't considered during that the design process, or that's come up as a part of the research. And that happens quite frequently as well. So limitations, delimitations, you'll get a question about that in the mid-semester exam. Basic applied continuum of classification. Now, so this question and a few is similar to, say, the instrument one that we'll get to later, where I mentioned last week, we're not going to dig too deep into this semester into like the nuance of what you think is more basic or applied and where they are in the continuum. We're going to frame a question like this in a mid-semester exam to get to that basic understanding that you might have at this stage of what separates from basic applied. So let's say that in this study here, we look at an exercise intervention as our independent variable, and it's an exercise intervention that's actually very commonplace in the rehab community, and therefore is something that knowing whether that's effective for a certain aspect of fitness is directly or answers a really direct question that clinicians have, and they can use that to either continue to implement that program or try a different program and inform their practice straight away. So if it has that effect, do you think it's more basic or more applied? Yeah, thanks, Lockie, on the chat there. Apply. Yeah, so it is. So if it's answering a direct question or can be used in the outside world straight away in some way, then it tends to be more applied classification of research. If the intention is to advance our scientific knowledge or methodology, then it's going to be more basic. So we could also have one. Let's say we switch the independent variable to one of age. So if we had age, or maybe even gender, to be honest, both of those independent variables would probably lend themselves to being more basic, because we're not going to do a lot in the clinical space straight away with the knowledge that different age groups respond differently or have different fitness levels, or different genders tend to have different fitness levels. That's really informative for further studies and maybe for interventions that we might do in the future, but it's not going to be directly applied straight away. And so those will probably be a little bit more basic. Qualitative, quantitative is pretty straightforward. So let's say we're comparing different age on VO2 max. Do you think it would be quantitative or qualitative?
Quantitative.
Yeah, that's it, quantitative. So that's kind of a gimme, hopefully, in the mid-semester exam. Most of our research and exercise science is quantitative. Certainly anything that we're measuring with numbers is quantitative. Obviously, there are some examples of qualitative, probably more in, say, sports psychology or exercise psychology. But we're probably not going to focus on those, say, for a mid-semester exam. So quantitative, anything where we're measuring something with a numerical basis. Experimental, non-experimental categories. So we've got 4 major categories and then kind of a 5th that we probably don't use a lot of in exercise science. So that's classic experimental, causal comparative experimental, correlational, and descriptive. Those are the 4 major ones. The historic classification of research. It's not a big one in exercise science. And so if we were going with VO2 max as our dependent variable and our age as our independent variable, and it's an attribute independent variable, what classification of the ones I just mentioned do you think this would fit into? Any ideas? Okay. Yep, causal comparative. Good one, Lindsay. So if age is the independent variable, because that's an attribute independent variable, it's causal comparative. If, let's say, if we had the exercise intervention was our independent variable, it would be a classic experimental. And finally, another one that we kind of briefly mentioned that we could do is, say, if we were looking at the relationship VO2 max and leg strength. What do you think?
Correlational.
Yeah, perfect. Correlational. We could also set this up as a descriptive type of research. So if we didn't have any independent variables and we were just reporting on the average and variations in spread, so the normative data for VO2 max for patients who are 6 to 12 months post-surgery, which might be quite informative as a baseline or sort of as normative data for clinicians to use, well, that would be just descriptive research because we're not doing any inferential statistics on them. So that one will definitely be one that you'll get in your mid-semester exam. I mentioned the instruments before. We're not going to ask you questions saying, is this instrument reliable, objective or valid, but we are going to get you to have a question based on knowing those three and potentially what those three might mean. So let's say that we're measuring, leg strength. So we're measuring leg strength with, actually no, let's go VO2 max. Let's go back to that. So let's say VO2 max. Probably most of you are familiar with the VO2 max tests we do on the cycle. So let's say we're doing that with the patients, and we're doing that as an indicator of fitness. So if we know that we have, well, basically, if we know that that is something that's quite repeatable for a single person testing, but it's a little bit different depending on the tester. So how they might create that environment, or the how they might motivate the person doing the VO2 max, then it would probably have a slightly reduced what? Objectivity, reliability, or validity. So which one of those three?
Objectivity.
Yeah, objectivity. So objectivity is the one that's based around different testers. Reliability is how consistent it is with the same tester, and validity is how well is it representing the actual, what you're inferring or the meaning of that test is getting out of. So how good is VO2 max as an indicator of fitness? Okay, good. So common research areas. So remember, we've got things like Hawthorne effect, we've got post hoc error, we've got central tendency error, we've got the John Henry effect and reverse John Henry effect, we've got placebo effect. So these type of common research areas. So let's say that we're looking at exercise intervention as our independent variable. So we have a control group where they're just doing whatever exercise they would do normally. And then we've got a group that's being supplied an exercise program and facilities to do that. What sort of common research areas do you think, might be possible?
Hawthorne effect.
Yeah. So the Hawthorne effect is kind of another freebie, hopefully. So if you get asked that one, there is very few examples in exercise science where we would test people without them knowing, or collect data on people without them knowing. Obviously, that's we wouldn't do that from an ethical standpoint, or there's lots of issues with that. So the Hawthorne effect is going to come into play in pretty much all research we're going to do, and so that's a fairly common one. Any others specific to this research?
John Henry be applied?
Nice one. So anytime you've got an intervention, you've got the potential of a John Henry effect, especially if they know they're in the control group or in an experimental group. You might have the control group either trying harder, so that's the classic John Henry effect, or you might have the reverse John Henry effect, whereas they're giving up. They're not going to try as hard. They're probably less likely to do any exercise because they know they're in the control group and they're never going to have a better VO2 max than the experimental group. So Hawthorne effects, John Henry effects, potentially the placebo effects. If you've got that exercise intervention, you might just feel better because you're part of that group. You know you should be getting better, and therefore that's going to help maybe do some other exercise, and therefore that might increase the VO2 max. And one that is a little bit more difficult to talk about in terms of design because it's more about write-up is the post hoc error. So post hoc error, every research is exposed to the potential of post hoc error, but that's really something that we interpret depending on what the authors are inferring from the results of the study and whether that matches up to what they're actually finding. Okay, so that's all the research methods concepts that we've got for that particular study example. So the last one would be the academic writing aspect. So you may get a multi-choice or a couple multi-choice questions on things like what belongs in different areas. So maybe I'll quiz you on a few of those. Where do you think the aims of a study would lie? Which section? Introduction, methods, discussion, results, conclusion. Any ideas? Throw it down in the chat if you don't want to yell it out. Intro, Michaela's got down there. Thanks, Michaela. You're exactly right. Yeah, the introduction. So introduction section would have the aim. And the convention really in academic writing tends to be that the aim is the last sentence or two in the introduction section. So we're really leading up to an introduction section. What would we expect from a results section?
I guess previous research that can help corroborate with your study.
Yeah, I think that. Yeah, that's a good one, Lindsay. So I think that, and that's a common one as well that people struggle with is the results. What's the difference between a results section and a results/discussion section? And so we have that. You can do either of those in research. And so a results discussion section would be those combined, and you often introduce your results with how that fits into the context of literature and what the meaning of those results are as well. If we're just going to have a results section though, then we want to make sure that we save all that discussion for the discussion section. So in a results section by itself, we don't have any context of what that means. We don't have any linking to other research. It's just a very, if it's not dot points and graphs and tables, any other writing is kind of written like dot points. This was the result of this t-test. This was the average for this. This was different for this. And then you get into the discussion of that later in the next section. So it's those sort of elements that we might tease out in the mid-semester exam. The other aspect of academic writing, obviously, that we've mentioned is that you will be writing the conclusion paragraph. So I probably won't get, I guess partly for the sake of time, I don't want to get too much onto that. And I know that a number of you are still completing the academic writing activity. So I think that activity is going to give you some good practice in not just writing that in the task 3 of the activity, but starting to rearrange those sentences in part 2 of that, or task 2 in that activity as well. So I'd encourage you to do that over the next couple of days if you haven't already. And then next week in the video conference, I want to show some examples of that. So if you can send me through any paragraphs you want. So I guess probably what I should mention, at the moment, I've just got the activity up there. Over the next day or two, what I'm going to throw up is the answers for that activity. So that's going to include, you know, task 1 and task 2 answers. So what they actually, the order is for task 2, for example. Task 3, I'm going to include the actual conclusion paragraph that the authors put down. That doesn't mean that your conclusion paragraph, if it isn't exactly the same, isn't good. In fact, I think that, you know, I've seen a number of conclusion paragraphs that students have done that I think are better than what the authors put down. So if you are interested in getting some feedback on your conclusion paragraph, send it to me. Hopefully I'll get some time to write back a quick couple of points, but what I'd like to do as well is to grab a couple of those and anonymously use those for some of the discussion next week on what those paragraphs look like. And if you can do some conclusion paragraphs on a different abstract, so the more you can practice, I think the better off you are as well. And if you've got those and you want some feedback, again, send them through. Hopefully you can use them in the video chat next week. Okay, so that kind of takes us through the preparation for the mid-semester exam and through that example research we've got there. Is there any questions that you guys have for that mid-semester exam preparation at the moment?
Will this document be posted on Leo?
Say again, Lockie.
Will this document be put on Leo?
I can put this document on Leo. Yep. So I might just put it up in the recordings box for the video conferences.
Matt, I'm not sure if you've put up a document or anything explaining like how many questions there are about the exam, but just wondering if you could tell us around like how many short answers, multiple choice and all that. Thanks.
Yep. So I think there's 15 multiple choice questions, 3 short answer questions, and 1 long answer question, which is the write the conclusion paragraph.
How many short answer again, Matt?
3 short answer questions.
3.
Yeah. So the short answer questions, we're not going to be asking you a lot of to write much down in terms of like, you know, a few sentences or anything like that. It's going to be mainly like, you know, list these things. So it may be, you know, if it's a research methods around variables, tell us what the independent variable is, or tell us what the dependent variables are, or list, the types of instrumentation considerations or ethical considerations or something like that. Any other questions, guys, about mid-sem exam?
How long does it go for?
So 50 minutes to an hour, I think somewhere in there is what we're deciding on or finalising now. So I'll just, in the email I send out at the end of the week, I'll confirm that with everyone. But yeah, it's somewhere between 50 minutes and an hour we'll give you guys. It's definitely not meant to put you under a lot of time pressure. When we've had it run it in class in previous years, students, so obviously that's closed book, but students have taken typically like 35 to 40 minutes would be the general time people would take, some shorter. I think if you're taking more than that, you're probably either overthinking some of the questions, or maybe you haven't prepared very much for the mid-semester exam. So that's our consideration with time as well. So because it is an open book exam, like all online exams are, we can, we're not intending to put anyone under time pressure, but also if we give everyone, say, unlimited time or 2 hours, then it probably reduces the need to actually prepare for that exam, because you can be doing some of the study during the exam time. Cool. Okay, so what we might do is just transition into the group research project. I know we certainly don't have everyone here who is in the class and working on the project, but I might just try and put some breakout groups of the names I've got down on my on the sign up sheet. So I'll try and get you guys into those groups, and if there's not anyone assigned to those, then just hang around and I'll talk to you about what your thoughts are, if you've got anyone that you've talked to about the research project. So it'll take me a second to assign everyone. As soon as you start to see so hopefully if you go down into the breakout rooms tab, you'll be able to see a room appear in the next couple of minutes. So if you can join that as soon as that comes up, then I'll be jumping in. So I'm keen to touch base with every group. Actually, I do have a couple of points here around where we want to be up to. So hopefully you can see that there. So to be on track this week, basically we've got to make sure that we've got a group, we've got a topic, that we've read some background literature on that topic, and then next week in the video conference, what I'd really like to be doing is to solidify people's research design. So who you're going to be testing, the dependent variable. So what are you actually measuring? Have you got an independent variable? And if so, what are you comparing? What conditions are you setting up? The procedures for that, what might you be controlling for and not controlling for? And hopefully this week you've got a bit of an ability to pilot test that on yourself as well. And then next week what we can do is give a bit of feedback on that design, modify it a little bit. Week 8 is when by the end of week 8 is where I'd really like the drafts of the information sheet, consent form and application sheet. So if we can get those in by the end of week 8, then I can use those to give you some final feedback on your study before data collection. And then if you can collect data in week, say 9, 10 at the latest, then you can be analysing that data by week 11 at the latest. And it'll give you enough time for us to give you feedback on that and be writing up and finish by the end of week 12. Okay, so what I might do is start assigning those groups. So just stop sharing my screen for now. And